Jean-Louis, I gather there's quite a history to the word sense, nonsense, senseless, because it has been concluded in the past that it's senseless to have such a late diagnosis in head and neck cancer. People have been talking about senseless. You had a campaign in the past with actors in it. Well, right now you have the Make Sense campaign. Could you tell me why have you got the Make Sense campaign associated with head and neck cancer?
As clearly the diagnosis was too late, we worked on awareness on head and neck cancer and awareness about the presenting symptoms. So that was the first part of the Make Sense campaign. We had a survey in Europe, across 7 countries in Europe, on more than 1,700 individuals from the general population, asking them, are you aware of head and neck cancer? And less than 1 out of 4 were aware of this. So when we ask about which symptom could be revelating an head and neck cancer, very few gave the good answer. So we say we have to improve the awareness about head and neck cancer, what head and neck cancer are, which symptom may reveal an head and neck cancer. That was the first part of the Make Sense campaign last year.
And how much of a benefit could there potentially be by getting more awareness going and perhaps diagnosing earlier?
I think that the presenting symptoms of head and neck cancer are very common. It could be like a laryngitis, a pharyngitis, an otitis. So most of the time the people are not very anxious about this symptom. And when they consult the general practitioner may at the beginning consider that it's a benign inflammatory disease and to treat with anti-inflammatory drugs or with antibiotics. And it's a loss of time before the diagnosis. So we say we have to improve awareness in the general population, but also in the medical population, in healthcare providers, including pharmacists, dentists, nurses, etc., not only general practitioners. So that was our target. So we decided to have different task forces within the Make Sense campaign. One was to raise awareness in the general population. One was to raise awareness in healthcare providers. One was to raise awareness in politicians, and one to improve the emotional support of the patients.
So could you give me some examples of what you have in fact been able to do to improve this communication?
So last year we had the first Make Sense campaign, and the major goal of this campaign was to improve awareness in the general population as well in healthcare providers. So we designed a brochure, a leaflet that was distributed throughout Europe, explaining in a very easy to understand way what head and neck cancer are: oral cavity, pharynx, larynx, nasal cavities, the risk factors, tobacco, alcohol, and to less extent viruses, and in particular the papillomavirus, and after the presenting symptom: difficulty in swallowing, change in voice, otalgia, lump in the neck, or bleeding. And we said, should you have one of these symptoms for 3 weeks, thus at that time you need a medical examination. That was a leaflet, 1 for 3.
Now you've targeted these to clinicians and to primary care clinicians and also patients.
It was for the primary care specialist and also for the general population. So it was distributed everywhere.
So what would you like cancer doctors to do about all of this? Because clearly there needs to be closer meeting of the
No.
primary care physicians with the cancer doctors?
What we wanted to do with the healthcare provider is to remind them that, for example, a notalgia occurring in a smoker and a drinker could be an otitis, but could be also a revealing symptom of a pharyngeal cancer, for example. So, because of course, during their life, the general practitioner have to treat much more otitis than cancer of the head and neck. So there is a confusion in their feeling of what could be a notalgia.
Right. Is there a way that cancer specialists could help the primary care doctors to reach this suspicion more easily?
So we have to improve the awareness, and after to improve the communication between head and neck specialists and general practitioners. So it's a continuum in the way of the collaboration between paramedics, medics, including general practitioner and specialists of the head and neck, dentist, and pharmacist.
So what is the take-home message that you would like to leave everybody with?
The take-home message is that the earlier the diagnosis, the better the outcome in terms of survival, in terms of cure, and in terms of functional results and cosmetic results.